nurse from the Our Lady of Fatima University. And today I will be assessing the transfer technique of patient from bed to stretcher. This is the intended purpose safety move for preventing any injury to both the patient and the healthcare team. This helps with proper body maintenance, infection control, and patient communication. But before I start for the assessment, I must review the medical records for the patient. This is to ensure the patient's medical record, and if I understand the patient's condition and any precautions that I may take to prevent any accidental removal. And next, I will perform hand hygiene and put on my PPE. And this is to ensure that hand hygiene is the single most effective way to prevent the spread of microorganisms for the patient, and PPE. It helps protect the patient and healthcare team from any other microorganisms or any infections. Now next, I will now identify the patient and explain the procedure. So, ma'am, what is your name?
I'm Rowena Hugo.
Okay, well, what is your birth date and age?
November 26, 1978. I'm 47 years old.
Okay, well, thank you. Now, I'll explain the procedure. This is a quick transfer procedure of a transfer technique of moving the patient from the bed to the stretcher. So, if I can garner consent, will that be all right?
Okay.
Okay. Now I will close the curtain for privacy. To ensure the patient's comfortness and privacy. And next, I will now apply the bath blanket. Now I will over the patient before removing the top leaf. Now, this is for the bath blanket, is to maintain the patient's privacy and also warmth and content and comfort throughout the procedure. And now I will now position the friction reducing sheet, the friction reducing sheet ball. This is to put under the patient, and also this is also to support the patient's weight and reduces the effort required. So stretcher and the bed. This is to ensure the safety transfer of the patient in case if there's any requirement surgery. So now I will position the transfer board gently away from the patient's stretcher and place the board right between the bed and the stretcher. Now I will then ensure proper hand placement. The nurse at the opposite side will now hold the friction reducing sheet at the patient's head and chest bone. So I will now be moving uniform.
Yes.
And now I will then I will now put transfer the patient to the stretcher above and the proper hand placement. This is to ensure and maintain the patient's weight and provide better and support of prevent any any dysfunction movements. So I will now move the patient to the stretcher. Here, 1, 2, 3. Now I will now secure the patient and remove the transfer board. As now securing the patient. This is to raise the side rails, reduce the risk of falls for the patient, and we'll use blankets to promote better warmth and comfort, and assist the client's comfort to ensure the better transfer to the transfer web. Next, I will now clean transfer equipment as facility policy. I will move my PPE properly and return the environment to a safe condition. So I'm now removing the transfer board out of the room. And this is to prevent the cross-contamination of the patient, and always wear proper PPE for removal and hand hygiene to reduce the transmission of microorganisms. So, conclusion, this concludes the demonstration of the transferring patient to stretcher technique. Throughout this procedure, we ensure the patient's safety, comfortability, and prevention of infections and other effective communications that for the team to consult and collaborate with. And always wear the appropriate equipment and attire that is needed for the transfer equipment. So this is a good, a successful procedure. I hope you enjoyed, ma'am. I appreciate both for your cooperation, and and have a good day, Paul. Thank you.